Hello there, this is Manit speaking, and this is the recap from the Health Security Roundtable Series 2. Many of you may not be familiar yet with these roundtable initiatives, but let me give you a bit of the context. During the COVID-19 pandemic, a lot of you have witnessed that our healthcare system have been vulnerable. Excess mortality rates around the world has pointed out that we lack of preparedness in our society, and the crisis management still has more room for improvement. The Health Security Roundtable was established to bring together experts, academia, and other relevant stakeholders to share their experiences in addressing the pandemic or managing the crisis in their own settings, and to share the lessons learned, how they navigate through these crises under different themes. And within this second series, the theme was to explore the impact of pandemic on our healthcare system with the focus on the ASEAN region. If you're ready, let's go and see it together.
So the first session was focused on the economic response to COVID-19, and then how we can learn from the previous COVID-19 pandemic to prepare for the next pandemic. We managed to find and agreed on some action plan for all the countries in ASEAN region, and then we give the floor to Thailand, to HITEP, to conduct the second session, focus more on in the human resource. We suggest to have a better and thorough platform to share data and a stronger leadership in ASEAN, because otherwise we will be competing against each other in times of pandemic instead of collaborating with each other.
The idea was to get some of the regional policy makers as well as the academics to come together to discuss the issue of health security, which we thought was important even before the pandemic.
First one is the human resource. So we have to recruit or enroll the health science student from the University of Health Science to help us in the control and prevention of the outbreak. We lack quite a lot of equipment and medicinal supplies, and the management or the preparedness. We had to organize the team very urgently, train them to cope with the situation at that time.
The first one is about our health system resiliency. So there's this vaccine supply disruption back then. It's not only that, not only vaccine, but also on the medical devices. We couldn't manage to produce a face mask. We need to import one of the materials. So it's revealing our fundamental weakness. I want to mention some things about the procurement hesitancy. Government officials do not have the courage to do the procurement, learning based on the historical event.
With this roundtable, we can learn what other country mechanism, process, or how they face the pandemic itself.
This roundtable series is very timely. At the same time, it's an important part of our preparation for future pandemics. We can also use this roundtable series as well as a networking and collaboration as well with other neighboring countries, so that we can have a more resilient and efficient way in handling health emergencies.
We learned a lot, and we think that we can take these lessons from other countries to be in consideration in order to prepare for the next pandemic in our country. Thank you.
And that is the recap and snapshots of what happened during the second series of the Health Security Roundtable in Bangkok. You like what you see and you would like to explore more, please feel free to click the link under the description box as well. I'll see you next time. Stay tuned.